Hi everybody. It is a great pleasure to be able to share this virtual space with you today. In this talk, I will briefly talk about my academic and professional observations in the field of autism research and practice, and I will answer one key question. Is it useful to use an experience-sensitive approach inspired by a life world model? Is it relevant to autistic mental health research and practice? I have been working for the past 19, almost 20 years now in educational and clinical settings, and I have experienced the opportunities as well as the challenges to meaningfully involve autistic people and their families at the heart of what we do, to establish autistic people's preferred ways to achieve their preferred goals. There has been lots of difficulties doing that, and these difficulties mostly stem from professionals' attitudes. Equally with research, do we always ask the right questions? Do we ask the right questions, employing the right methodologies? Much of the work I have been doing the past 6 years that I have joined higher education, doing my PhD research, doing my postdoc research, teaching, lecturing and training mental health workforce. The key question that I aim to address through my different hats and my different roles is how do we move from fixing autistic people to mutuality, to working with autistic people, to creating safe spaces for autistic people to thrive, and an experience-sensitive approach. I'm hoping that it is towards the right direction to answer this question. Moving from clinical and educational work to academia, doing my PhD meant that I had to read a lot, meant that I had to take my own decisions about my research design, and most importantly, my epistemological approach. Am I going to work with people? Am I going to research about autism, or am I going to work with people to do research with autistic people and the family members? And am I going to view eventually people as objects or as experts of their own lives? And then another thing that I noticed is that in the places where I have worked and studied, there is this kind of tyranny of the quantitative. This big love for numbers, for hard data and big statistics. And although population big studies can be very, very important and inform us and inform clinical practice, very often numbers do simplify the complexity of human existence and denies the agency to autistic people and their family members to define themselves, to control the narrative, and to let us know what is it that works or doesn't work. There is also a lack of an established ideological position, which I noticed very early on from my readings. A lack of framework, a lack of recognition that local people of all ages and all abilities have the human right to be involved in decisions that affect their lives. And this is one of the key reasons that I got very much into thinking about an experience-sensitive approach and applying community-based participatory research models such as photo voice. I was almost fed up by the fact that clinicians were one group of people doing things, and then researchers another group of people, and then when you meet autistic people and the families, they're completely isolated and talking about their experiences. So it really struck me why we think beside each other, and why don't we work together. And if you look at Einstein's ladder of citizen participation, you might recognize different ways that traditionally people have been working together, mostly not recognizing much power to service users or to people with lived experience, trying to manipulate different variables. Very often nowadays participatory research is consulting people with lived experience, and there are different degrees in terms of tokenism there, and much less often people are recognized as citizens who are able to take decisions about their services, about their physical and mental health and research that they would like to see in the field. Engaging with autistic people in my extended family, in my workplaces, um, in my circle of friends, and at the same time reading about autism from scientific research created a very big paradox for me. The concepts used by researchers, by governments, by charities, by policymakers very often have very little to do with how autistic people and their family members actually experience their lives and express their needs. So, for instance, started reading about family research. Previous studies mostly focused on parental experience of having an autistic child. Very much neuroscience and genetics and medical research um, describes autistic people as aloof, aliens, selfish, mind-blinded, describes family members as being at risk, living in a household chaos, and very much when it comes to relationships, autistic people need to be taught on how to behave and how to relate with the world. And then you speak with real people in real life, and you hear about their efforts to navigate a system. You hear about their need to belong. You hear about their creativity and how autistic people can actually inspire their non-autistic family members. The pain as well as the love that coexist in the relationships. Autistic people being siblings, partners, friends, writers, dancers, poets, teachers, citizens, basically, and how the focused and special interests that they have and their hobbies basically trigger well-being, and then on the other hand, how society's deficit to embrace autistic identity is causing lots of pain, mistrust, lack of access to educational and healthcare services. And I think this paradox is because we do not have an experience-sensitive approach, is because we do exclude the autistic voice from family and mental health research, and that exclusion reinforces the devaluation of autistic people. And the final observation, as I go through the literature in the field, as I have conversations with clinical places, professionals, other researchers, we don't use the word love. We don't talk about mutuality. We don't talk about ways to be together. Whose narrative is it anyway? As Donna Williams said in the 90s, right from the start, autism has been defined by non-autistic people, by what non-autistic people think or say or do to autistic people. Why we don't use the word love? After all, it's love that is a central feeling in the heart of each family member, and it comes from a place of love for many of us who work with or research with autistic people and the family members. And autistic people are so uniquely and sensitively connected with so much love to the world around them. However, we don't talk about love. When we talk about autistic people's relationships, we assume pathology. We assume that they are a burden for their other family members or for the society. And love matters, mutuality matters, because it's as well that relationship and mutuality element between autistic people, their families, and professionals that are often considered to be most effective when they represent true partnerships. When there are some key characteristics such as working together, and these are characteristics that can be found. Qualities of a loving relationship can be found in loving relationships, such as mutual respect, trust, honesty, shared planning, and decision making can only grow with this element of love. Based on my previous slides where I explained my professional and academic observations, I do believe that there is something missing in contemporary health and social care when it comes to autistic people's lives. Autistic people's health or illness is often measured in policy documents and economic terms, and clinical outcomes are immersed in statistical data. Everything is measured by behavioral tools that have been made by non-autistic people for non-autistic people, and autistic people's and the family members' experiences are left outside. I'm going to present briefly some of the dimensions of a life world framework, what I call an experience sensitive framework that has been very much characterizing my approach to research nowadays, which is in line with an explicit social disability shared ethos, contributing to a move towards new ways of thinking about autism research that do not rely on existing deficit-based narratives. Um, the idea of life world research is not new per se. Nick John, Les others in the past have used that, and I have modified and found specific, extremely useful some specific dimensions, such as considering the insiderness, the importance of the insiderness of the experience, autistic people's hopes, fears, struggles, their ability to be in an agency position to make their own decisions, the uniqueness of their experiences. Not all parents of autistic children are going to just fit under one umbrella and have the same experiences. Not all autistic people can just fit under one umbrella term. People need to be seen as individuals for their in their roles in their communities, and the many identities that they carry. The sense of place, both in terms of feeling welcomed, feeling safe, but as well feeling sensory comfort and sensory autonomy. The sense of embodiment is another important dimension, according to which its autistic experience of living and being should be seen beyond the narrow definition of autistic people being full of deficits, enabling positive personal identities relevant to their strengths is a really key important dimension in when we construct our ideas and research questions. And last but not least, the sense of togetherness. Autistic people should have access to people they value, that they feel that they can share their worries, their agreements, their disagreements, as well to have fun and to share intimacy. The 8 dimensions of the life world adapted model, what I call an experience sensitive approach, fit very nicely with collaborative and participatory models. In fact, in order to gain knowledge from the perspective of those who we study, there's only one way to do it, to work with them. So it's all about encouraging and creating the right circumstances for people to be involved in decision-making processes around research and practice that affect their lives. An experience-sensitive approach is a collaborative approach. And as I have learned from my good friend and collaborator, Cos Michael, when we talk about participation, it's a mindset thing. There's not one manual on how to do it. It's more a philosophy than a specific set of methods that matters. It's about seeing people as active agents. It's about seeing people, local people, capable of doing research, of analyzing, of planning with researchers and practitioners. Is about being able to embrace the fluidity of roles, to be able to reverse, to hand over the stick, and for researchers to mostly be facilitators, creating a safe space for autistic people to take decisions and to shine and to work in their preferred ways. It can be audio, it can be visual, it should be flexible, it should be focusing and capitalizing on local people's perspectives and strengths. In the next few slides, I'm going to give you examples of how I have employed an experience-sensitive approach combined with collaborative research designs, and some of the ways that it was truly illuminating for me, helping me to move from someone else's narrative to autistic people's narratives. The first time I interviewed siblings, talking about their experiences growing up with an autistic family member, I said, "So what is it like to live with autism?" And the majority of them looked at me and said, "Well, I don't live with autism, I live with my sister, or I live with my brother." And it has been really a privilege to hear from and learn from the personal accounts, personal accounts that, in contrast with the cultural narrative of tragedy and disaster that has been inflicted upon them, show love, show connection. Their personal narratives show how resourceful and empathetic autistic and non-autistic siblings are towards each other, how much stressed they are about the future, how much they need respite time, how much they're able to model acceptance and inclusive behaviors to their parents, to their peers, to their local communities, and how much they suffer at times from stigma. Knowledge exchange and public engagement programs in universities have also started attracting lots of attention. And recently I had funding from UCL Culture to work with autistic and non-autistic artists, and together to co-create a safe space for people to explore autistic adults' relationships before and during the pandemic. Again, an experience-sensitive approach, moving from medicalized approaches that want autistic adults to be emotionally disabled, helped us to capture the many ways that autistic people are affected by the sense of empathy for others, for the world, the ways that their special focused interests are inspiring them, are helping them to cultivate positive feelings and connect to the world in unique ways. Through poems, films and drawings and photography, autistic people spoke about feelings of loyalty, feelings of love, their agony, their hopes, the painful effects of camouflaging, and how much injustice can hurt, and the social determinants of their mental health and the ways that they are able or disabled in connecting with others. We have a rich selection of poems, drawings and films, and part of these can be found in our website, but also we will have a live exploration on the 21st of May as part of this festival. Hope to see some of you there, where we can talk more about. The next example is from a piece of sleep research. A piece of sleep research that was not based on traditional measurements that have been made by non-autistic people for non-autistic people. It has been a piece of research that declares an interest in sleep, which is an issue that remains unrecognized as a lifespan issue in the majority of the autistic population. But for that piece of work, I worked with teenagers and moved beyond the common narrative of addressing sleep problems as a deficit in their behavioral repertoire. So this is the first study to obtain a personal accounts perspective, honoring their experiences of young people, their sleep experiences, and having a very holistic approach, but about what is it that can help young people to sleep better at night. So I asked the young people to work with me and to generate their own photos, drawings, to bring objects and words, to introduce subjects and ideas that are meaningful and important to them around themes such as the place they sleep, the surroundings, the activities and objects that relate to their sleep, objects, people, or drawings that show how they relate to their bedtime, what are the thoughts during the bedtime, and what factors during the whole day, so for example when they are at school, might play a role in how they choose to unwind their mind before bedtime. We also arranged a community knowledge exchange event to open up the discussion, bringing together autism researchers, sleep practitioners, teachers, parents, developmental psychologists, again, as a way to shed light to the unique perspectives that young people bring, perspectives that are telling us about a need to holistically look at sleep issues beyond the behavioral perspective and adopting a more humanistic view of well-being and mental health. And this has only been possible by looking at the dimensions of people's lived experience and not relying on a priori categories in questionnaire. Thank you for your attention today. I hope that the examples I have offered have helped you into thinking about the ways that an experience-sensitive approach combined with collaborative research practice can maximize the possibilities for research that is addressing autistic people's perceived needs and a greater real-life impact in areas that autistic people have chosen for themselves. It's all about really moving from someone else's narrative, often centered in behavior, to people's lived experiences. Please do keep in touch. Huge thanks to my collaborators and to UCL Culture and the John and Lorna Wing Foundation for their support. Keep in touch and enjoy the rest of the festival.